My name is Shawn Spooner, and I'm a UnityPoint Clinic doctor. At UnityPoint Clinic, I serve two roles. I'm a primary care sports medicine physician, and I am a family medicine urgent care provider. You know, I grew up in a small farm town in Iowa, and I think there you really appreciate what community means. And as I advanced in school and found what I was good at and enjoyed doing, I really found that I liked service and I liked to give back to the community. And I've always found that medicine and healthcare is a great way to do that. What I want patients to know is that when they come to see me, whether it be for sports medicine injuries or acute injuries or illnesses, that they're going to receive the same level of care that they would receive from their own provider. It's going to be caring, compassionate care. I'm going to treat them like I would my own family members. They're going to be given the appropriate amount of time to really accurately diagnose and find out what's going on with them, to come up with an individualized treatment plan that's right for them, that makes sense, and that they understand. And then furthermore, I want to make sure that once I treat them, that they receive good continuity of care and appropriate follow-up, whether it be with their primary physician or if they don't have one, to ensure that we find the right resources that are appropriate for them and what they need for long-term health. I did most of my family medicine and sports medicine training in the United States Navy. I just finished a 9-year career in the Navy. Mostly I took care of Marines, sailors, and some airmen. I did so mostly in the realm of sports medicine. So I took care of our military athletes, that being our Marines, soldiers, special forces individuals. Most recently I spent a better part of the last year running a concussion restoration care center in Afghanistan, where I really fostered an interest and a passion for appropriate care of concussions and post-injury care. I have with me here my cycling helmet. I have a deep interest in cycling and all sorts of endurance events, but I also have a real interest in injury prevention. So what I do focus a lot with the athletes and the individuals who come see me in my clinic is the prevention of injury. One thing we do offer in my clinic is a functional movement screening. It's a tool we use to identify risk factors for injuries so that we can identify people at risk before they get hurt in the first place. This is really important in young, growing athletes and anyone who is active, whether it be in sports or a physical occupation. But we have the opportunity and tools now to really identify movement disorders and things that might place someone at risk for injury, or after an injury, identify reasons why they got injured in the first place and mitigate those so that they don't get hurt again. My undergraduate training was at Iowa State University. I did go to medical school at the University of Iowa. So I would say that I support all of our in-state teams, but when it comes down to it, go Cyclones.